Currently, I'm a physical therapist at an orthopedic setting. I work with a group of surgeons. My short-term aspirations are just to maintain stability in my position and how I perform my job. My long-term aspirations are to use my current experience to pursue a management position either at my company or at another setup. I don't have a fixed position that I know I want to work for, but I'm sure my experience of supervising people and working with a team will help me determine or be good, somewhat good at a management position. I'm still looking to see what is out there for me long term. A good challenge always motivates me, something that can fire my brain up. If things get mundane, I get demotivated. If it's the same thing I'm doing every day, I don't feel like going to work. I did have a job in the past that was similar to that. It wasn't challenging me intellectually. And so over time, I did not like the job that I liked a few years ago when I started. Oh, I think I answered long-term goals for long-term aspirations, but my long-term goals kind of coincide with my aspirations. I want a job that is going to help me use my current experience, but also lets me spend more time with a family. I just had a kid, and it has made me realize that my goal is to spend as much time with my family as it is, or more even so, than I spend at work. And I'm just gonna wait for the next question. But maybe as I wait, I will answer one more thing that motivates me. Baking new recipes. My husband is vegan, and just coming up with a good vegan recipe that he likes motivates me. So, an example of when I've identified an improvement to an aspect of my business operation. Last year, we were in a pandemic, and being in healthcare, an outpatient physical therapy department, when a virus that is spreading through touch or through the air, the last place you may want to be is in a closed room with people in it. And my employer, luckily, was able to pay us full time, but we were not working full hours. I was barely going twice a week to work. And as I mentioned in the earlier statement, in the earlier question, that, if it's not challenging, it demotivates me. And so sitting at home, I was just getting demotivated and with my career or my profession, I want to say. So it made me thinking that what can I do to change this to help the business, to see how patients can continue to get their care, but not having to come in. And I started doing research about telehealth physical therapy, and it always existed, but no one had really used it in the past. And this was the perfect opportunity to introduce it to our practice. But then there are also, how do you bill for it? Does all insurance cover it? So I had to do all that research. And I was able to do it and present it to the director of my company, and he approved it. And in 2 weeks, we were providing telehealth physical therapy. And I was able to get half my patients back on my schedule. And even though I was going to work, they didn't have to come in. They were able to get their care just sitting at home, not putting themselves at risk during a pandemic. So the outcome was pretty amazing. And it helped my company keep, the patients coming in, the income. Also, one of my patients wrote about their experience with me on the Texas Physical Therapy Board. So it gave me a sense of pride that I was able to accomplish something. And I realized applying these learnings from the situation, I haven't done that yet because I have not been in a business operation situation again. This was the first time that I started something on my own, presented it to a higher up, and the operation was successful. But I'm looking forward to utilize these skills that I have understood that I have in my future job or in a management role that I could possibly have in the future. A situation where I develop an employee's capability. So I do supervise physical therapy assistants, and I do have an assistant who is fresh out of school and she does not have a lot of experience, but she does see my patients, and so I do want her to, over time, become more experienced, learn new skills, so when a patient goes from me to her, they don't see a fall in their care. They see consistency. But I had a few patients tell me that they were not happy with her care, and so I wanted to address this with her. I'm not very friendly with her, but I know to accomplish good service, we have to work as a team, and we cannot let our patients realize, and I don't want to put her under the bus, when it comes to patients, like they need to see us as all of us are great. So I decided to talk to her in private about it. I mentioned to her how I'm there to be her mentor, and I'm happy to teach her things that she finds difficult or wants to learn. And then I slowly pointed out as to the specifics and where she could improve. The difficulties I encountered was that she wasn't very, she did not take the criticism well. She thought I was attacking her, trying to directly tell her that she's not a good professional. I still try to keep my demeanor. I approached her a few more times about the same situation. And she did give me feedback saying that she feels great that I am coming up to her and trying to get her to improve. And she appreciates that. Although after the 1 or 2, maybe 3 conversations, she never really approached me about it, and I never really saw a change in her with her skills, or trying to come to me, wanting to ask more questions, trying to get better at how she performs treatments with my patients. So I didn't see any improvement. And so she also never got back to me about different ways in which I could help her better. And so eventually I decided to give up. 2 months later, we hired a new physical therapy assistant, and he was more experienced and he was great with my patients. So I decided to give most of my patients to him. An example when I have set directions for others. There has been a time when my boss, on and off, my boss is off, and I am the supervising therapist at work. And basically, I'm in charge. I am the boss for the day. Basically, I handle, in these situations, if something comes up, I'm supposed to decide who does what and do what my boss does. And yes, I do have the leverage to call him or text him if need be. But when he's off, I try my best not to do that. So there was one of these situations where I was the only therapist, the lead therapist working. And I had 2 PT physical therapy assistants under me. And I have to see surgical patients and non-surgical patients. Surgical patients are upstairs on the 3rd floor. Non-surgical patients are on the ground level. There's always been situations where I have so many patients on the ground level that I have no time to go upstairs. And then the nurses on the top, they get mad because the patient is waiting to be discharged. The room is taken. They have to try to move the patients quickly so that they can bring in new patients. So I was working with my patient, and the nurse kept calling a lot of times. I took her call once or twice, told her that I'm very busy, and I told the receptionist, the physical therapy assistants, that we have to work in the situation where we can see maybe they take one of my patients, and then I can go upstairs and see the patient so they can get discharged. Although the nurse was not willing to give us even a little bit time to figure out our situation at the ground level so that we could go upstairs and help her out as well. So I ended up having to text. Actually, my boss, before I texted my boss texted me saying the nurse is calling for you to go upstairs. At that point, I was very frustrated, and I had to tell my patient downstairs to give me a little bit of time to go upstairs and take care of something. My patient was very understanding, luckily. I went upstairs and I decided to talk to the nurse before I saw the patient upstairs. I told her our situation, that, hey, we have a really busy schedule downstairs. It's just me today. My boss is not coming. And she understood at that point when I explained the whole situation to her, and she apologized. I saw the patient and then came downstairs to see my patient as well. So in my work, there is a lot of you can make false commitments saying patient comes to you and they say, my knee is hurting, it's not bending as much, I'm not able to run. I could say, hey, yeah, in 3 weeks I'm going to make you pain-free and you're going to be able to run a marathon. But that's possibly not the case. So usually I try not to make commitments to my patients. But when I see a patient a similar patient who I've seen before, and I know in my experience that I can help this patient with the pain in 2 weeks, then I have made that commitment in the past. But it also depends on how much the patient does at home, how much he listens to you. For example, if you tell them not to run for 2 weeks, are they listening to you, or they continue to run and inflict their pain? So that was a patient who did not listen to me. They were not doing their home exercise program. They were continuing to inflict pain. Every time they came in, they would blame it on the therapy treatment. In that situation, I kept reassuring that the patient needs to stop running so that they can get better. At that point, the patient refused that they were running. They would say they were running just a little bit, not a whole lot, although I did not trust that patient. I'm sure they were running about 3 to 5 miles and causing pain after every treatment. What could I have done differently? I could have maybe taken the time to educate the patient more on why I was emphasizing on them taking a rest break from running. Maybe given them more examples, maybe a real life example of my own, because I used to be a gymnast and I've done that in the past. Maybe making the example more personal would have helped them understand better. And so I learned that, well, one thing I learned was I cannot fix all problems. At some point, some people, they don't want to listen to you, and there's nothing I can do about it. But at the second point, I think I can go out of my way a little bit to educate the person as to why I'm not able to fulfill my commitment. And maybe to a certain extent, take the blame on myself as well and not just blame the other person. So in another situation, I would try to see how I can approach the situation differently as to just blaming the other person for not being able to complete the commitment. Maybe see what I can do differently to, if I'm not completing the commitment, or if I'm unable to complete it, then how can I not necessarily blame the other person, but see what was wrong within me instead.